goal line than we're closer toward the goal line than we've ever been. Okay, so I think we're about at the end, and I just want to, is there anyone else here who needs, there's Cynthia down from Senator Warner's office. I called you. Okay, all right, I'm gonna give you whatever, you gotta be out here and,
1 minute.
okay, come on.
Hi everyone, I'm not a warrior, but I am a caregiver and I work in the healthcare system, and sometimes it's hard to notice items. But I bring you greetings, thank you to the Sickle Cell Caucus, and thank you to the Virginia Assembly and everyone is supporting. Ayana brings you one word. She was unable to make it from Tuscaloosa, Alabama, because she has not been well. But she said to tell you hope.
Okay.
She said to tell you that warriors are not defined by sickle cell disease. It has them, but it doesn't define who they are. So we're going to continue to bring awareness through Ayana's initiative. It's the READ initiative, Readiness to Educate, Advocate, and Diminish Hopelessness in Sickle Cell Disease. Thank you.
Thank you. Again, and these are just some statistics, and Dr. Smith, if I'm wrong on this, I give you permission to correct me publicly, okay? But nationally, it says that approximately 100,000 Americans
More.
are living with, thank you, sir. Are living with sickle cell disease. Here in Virginia, what is the estimated on that?
We're 5, maybe more.
Okay, I had 4,500.
Yeah.
4,500, and then approximately 155,000 individuals carry the trait. Is that right? This number represents, and this is the most important part, it represents our neighbors, our family members, classmates, and colleagues. They represent lives deserving of dignity, comprehensive health care, and equitable access to the treatment. And to the families those who have lost loved ones, we want to say to you, we honor your grief, your love, and your continual advocacy. Your story reminds us why this work is so urgent. They are legacy that fuel our commitment to change. Research shows that individuals living with sickle cell disease can have life expectancy that are approximately 20 years shorter. And we want to cut that, we want to put that to a stop, a halt. They should have the same life as everyone else, and it takes, again, it being on someone's radar, and people fighting for this and advocating, and I promise you that is what we are doing here in the state of Virginia, and the Commonwealth of Virginia, and the legislators who have stepped forward to put forward legislation. It compels us as policymakers, healthcare providers, and community leaders. We just need to understand the scope of this disease in Virginia. We need to understand the scope. We need to know who's affected by it, who's impacted, the numbers of babies, and once we can get our hands around that, I promise you, we're going to continue the fight and continue to move it forward. So again, I want to thank each of you who have come this morning. I want to thank you for your advocacy. The healthcare community, thank you. For those who are warriors, who are brave enough to share your story, your testimony with us, thank you. And then certainly my colleagues who are at the various probably committee meetings right now. I want to say thanks to everyone who have taken this on and believe that this is the right thing that we're doing, and the only way we can bring about transformational change is for, as a community, for us to come together and make certain that we are paying attention, not just us, but the Commonwealth of Virginia. Everyone's paying attention to this. We must work to eliminate stigma, increase awareness, improve access, ensure that every Virginian living with sickle cell disease receive the support that they deserve. Your strength today inspires all of us. Your voices help to shape policy. Your lives drive movement. to the families, your advocacy, keep this issue at the forefront of public health. To our healthcare partners, your expertise bring healing and hope. Together we can build a Virginia where individuals living with sickle cell disease experience hope. They live longer. Their quality of life is improved. And equitable health care outcomes. Again, thank you for your commitment, for your partnership, for your dedication to advancing the mission of the Virginia Sickle Cell Caucus. Let us continue to work together to ensure that sickle cell truly matters in the Commonwealth of Virginia. God bless you and thank you.